start my screen sharing. Huzzah! Okay, excellent question. So on last Thursday, we started on this whole monstrosity, right? So we're looking at chapter 11, which is the muscular system, right? We'd already talked about muscle tissue last Tuesday. We started on muscular system, as in naming the muscles, on Thursday. And we talked about all the muscles of the torso, basically the head and torso, head, neck, and torso, if you want to be real specific, on Thursday. So we talked about all these that are our total two head muscles, all of our facial muscles, the neck muscles, and then the muscles of the chest and abdomen, as well as the stuff on the back, upper back, lower back, back of the neck, back of the head stuff. So today we're going to talk about the muscles of the arms and legs. And so we're actually like on track from the original class now because we would have been dissecting the arm and leg muscles of the rabbit in class today. So does anybody have any questions about the head, neck, and torso muscles that we talked about last Thursday? There was one great question about what we're going to be talking about today in our muscles discussion, which is a thing, and you should check it out and ask me your questions there. But somebody asked about the difference between the brachialis and the biceps brachii on your lab worksheets. So just to reiterate, I assigned the human body coloring book pages that correspond to the three major muscle groups, basically, that we've covered so far. So I made lab 17, the head and neck muscles, which covered pages 58 through 60 of your coloring book. This is all on Canvas. Lab 18, I made the muscles of the thorax, and then lab 19, I made the muscles of the arms and legs. So in lab 19, and on all of these actually, the ones that are paired like this, that where you have like two pages that are meant to be viewed side by side, you have one side that is the superficial muscles and one side that is the deep muscles, right? So just remember that you're looking at the same part of the body, but one page is the superficial muscles and the other page is the deep muscles. And that holds true for the muscles of the arm, which is on page, shoulder and arm, pages 70 and 71, right? So we've got the superficial muscles on page 70 and the deep muscles on page 71. So what is confusing, or may be confusing, and I can see why, very clearly why that it would be confusing, is that this muscle on the superficial side is labeled the biceps brachii, right? And what appears to be the same muscle over here is labeled the brachialis. So the difference between the biceps brachii and the brachialis is that one is superficial and the other is deep. So all of these muscles on this page, page 71, on the right side when you're looking at it, are muscles that you can only see once these superficial muscles are dissected away, okay? So the brachialis is, in essence, below, it's underneath the biceps brachii that you can see over here. So
thanks for explaining that, because I finished all my labs and I was confused on that arms and leg one.
Be very, very clear on what it is exactly you're looking at. And it does say at the bottom, it'll say the superficial muscles, and then the other page will say the deep muscles. So just make sure that you're clear on what it is exactly that you're looking at, whether they are deep or superficial muscles. And on this image that I have in the PowerPoint, where I have all the muscles that you need to memorize, these are mostly superficial muscles. There aren't a whole lot of deep muscles that can be seen here. The muscles of the torso, where they have dissected away this half of the torso, that's really where you can see most of the deep muscle stuff. They didn't dissect away on the posterior view. So these are the really important like deep muscles that are actually like invisible in certain circumstances. Most of the muscles that are considered deep muscles that you are required to memorize are muscles that can be seen, at least for the arms and legs and the head and neck, that can be seen whether or not you have dissected anything away. So from certain views, like this one, you can see the brachialis. So you can actually see a little chunk of it down there, but it's underneath the biceps brachii right here. So when you're doing your human body coloring book, make sure that you can tell which side is the superficial, or which ones are superficial and which ones are deep. Make sure you know what you're looking at there. And by superficial and deep, it just means that one is on the surface and the other one is underneath, right? So remember when we talked about the anatomical positions and stuff, and we were so confused about superficial and deep, and I was having a hard time explaining it. This is really where that comes into play, right? So besides like the integument, where we talked about the epidermis being superficial to the dermis, right? That type of thing. The muscular system is really where the superficial and deep terminology and the distinction between the two is really, really important, where it gets really, really clear. So it's usually referring to muscle stuff when we talk about superficial and deep, and here we are talking about superficial and deep. So again, and on this picture, coincidentally, it's the same situation on the left side, at least for the torso. You can see the superficial muscles like the pectoralis major and the external oblique, while the deep muscles are pictured on the right side here. So obviously you can see these superficially on both sides, but on this picture, they drew it so that those muscles were dissected away so that you could see the deep muscles underneath, including the pectoralis minor up here, and like the rectus abdominis and the internal oblique and the transverse abdominis, that type of thing. But again, on the arms in this picture, there isn't like a superficial version and a dissected version. They just have it all the same, because for the muscles that you need to memorize for those, you can either see them, even if it's just a little piece of them, or not to say that they're not important, but I'm not asking you to memorize them for this class. Okay, so I thought we'd start with the arms. I was doing a little bit of digging in our Wiley Plus, and I discovered this lovely interactivity. So I basically went into Wiley Plus, scrolled down through the modules to the muscle chapter, chapter 11. Here's our muscle tissue chapter. Lots of good stuff in there too. Don't forget to check it out. But the muscular system chapter, and went flipping through the stuff that we already looked at to find stuff that we're going to talk about today. This is kind of sort of getting into that. We've got muscles of the thorax and shoulder, the pectoral girdle, and I know we haven't really talked about some of those things yet. So going into that module, looking at it just takes you to the learning hub, right? We've got our inner activities here. Going into there, we've got a few, we've got a couple of things showing us like how tendons looks like, or ligaments work, which is not something that we've really talked about or will talk about, but might actually be really interesting to see. It's actually just a video to show you how those bones move, what those actions look like, minus the muscles that are actually doing the actions. But I don't know how long this is going to take. So check those out. The inner activities are, they're kind of simplistic, but they're kind of neat. They do show you a comparison between an illustration and the cadaver, the dissecting cadaver, which we are also going to be looking at today. Again, if you are wondering where to get to that, this real anatomy dissection cadaver, you're going to go into any of the little sections on any of the modules and go to the Explore tab, and you will find the real anatomy, including the dissection and everything under there. So that's how I got to here. Okie dokie. Okay. And I had this open to, basically you can expand whatever you've got up here. Yeah. So if I expanded this interactivity over here like this, is basically I got this over here. So I've got our dissection dude.
Actually, what page are we on the book?
In the textbook, we are roughly around page 400. So muscles of the thorax and the pectoral girdle. I'm kind of glossing over a lot of the stuff that's in the textbook, because we're kind of treating it as like muscles of the thorax and then muscles of the arms. So less so like muscles of the pectoral girdle proper. I would consider them, I guess they're really that's kind of synonymous to muscles of the shoulder, right? So we're gonna start talking about the muscles of of our extremities, of our appendages now. So let me just get a view of this dude's arms. We'll dissect away the skin, the subcutaneous layer, and then we'll dissect away some of these, all those blood vessels and nerves that are kind of blocking some of these muscles from view. And let's switch to a lateral view. It gives us a little bit of a clearer picture of what's going on here exactly. So I'm going to start up here on the shoulder. We have already talked about the muscles of the chest here. So on the anterior side of the torso, on the anterior side, where the chest is, we've got the pectoralis major, of course. And on the back side, we've got the trapezius muscle, right? We also had some other deep muscles, the infraspinatus, right, which was over here. And underneath, we had the rhomboid major. So actually, if you dissect away this guy, oh, wow, I actually accidentally clicked on a nerve there. Pardon me, buddy. I don't know how long it takes to get the that trapezius muscle dissected away. It is very superficial. I wouldn't expect it to take that long, but it looks like we're removing the deltoid muscle before then. Sorry, I'm just trying to get down to the rhombus major, the rhomboid major. Oh, there it is. Hello. Okay. So the rhomboid major and it looks like we already dissected away the infraspinatus. I don't know if there's a view. Oh, there it is. Okay, so there's them both together. The trapezius goes over that. And then apparently the deltoid is considered to be superficial even to that, because the trapezius was dissected away after the deltoid, which is interesting. So I'm going to start with the arm muscles with the deltoid here, which is kind of our, it's our shoulder muscle. So I figure it's kind of our gateway to the arm, right? So the deltoid does originate at the scapula, right? So it originates up here at our shoulder joint, and it inserts at that deltoid tuberosity on the humerus, right? So it helps you to abduct your arms, right? When it contracts, when that muscle contracts along the fascicles, right? Because the way that the fascicles are running is the way that the muscle is going to shorten, right? Because of reasons, chapter 10 reasons, all that zooming in that we did to see down a muscle, down to a fascicle, down to a muscle fiber, down to the myofibrils, down to the sarcomeres, right? All of that contraction action is happening along the lines of the fascicle, right? So the lines of the fascicle are going to indicate that direction that that muscle is going to shorten. So when you see those fibers of the muscle, you know the muscle is going to shorten this way, like this, right? So as it does that, it's pulling, and it's going to be abducting your arm. It contracts to abduct your arm, and it relaxes to adduct your arm. So it is the prime mover of abduction, and it is the antagonist for other muscles, namely your pectoralis major, that adducts your arm back. So remember we talked about prime movers versus antagonists back last Thursday, and how prime movers are the ones that are contracting to cause a certain motion, and the other muscles around it are considered the antagonist, and they have to relax in order for that to happen. And then what was once the prime mover becomes the antagonist in the opposite motion, right? Adduction. And then those muscles that were the antagonist before become the prime mover, right? So there's always a pair, at least a pair of muscles that that pull in opposite directions. So they do both sides of the same action, right? Flexion versus extension, abduction versus adduction, etc. So your deltoid muscle is going to show up here on your list of muscle actions that you need to know for these particular extra super special muscles. Not that they're any more special than anybody else, but they're pretty major and bear memorization in terms of their action that they do. And you can see that the deltoid muscle does arm abduction as its action, right? Okay, so there is our deltoid, and if we dissect it away, you can see the head of the humerus here. You can see the infraspinatus that is also interacting with this pectoral girdle, with this shoulder joint, right? And you can now see the heads of the next muscle down that we're going to talk about, which are your triceps brachii, your biceps and your triceps, right? So we're moving down the arm, right? We talked about the deltoid, which is this guy, and we're moving down the arm. On the anterior side, you of course have your biceps brachii, right? Your bicep. It's called your biceps brachii formally in anatomy because it actually has two heads. It's a two-headed dragon in there, right? So it actually, I actually had this really great image to illustrate, rearranging here, to illustrate the brachialis versus the biceps brachii. Yeah, check this out. So in this image, you can see that the biceps brachii actually has two heads or two origins up here with the pectoral girdle, right? So here is our the condyloid process of the scapula, right? Here's the clavicle with the end that interacts with the acromion. Yeah, the acromion of the scapula, right? And that's the acromial end of the clavicle right there. And then the head of the humerus, which is fitting into the glenoid cavity of the scapula, right? So that's the socket of your shoulder joint. So you've got two different little points of origin here for the biceps brachii. We think about it as being one muscle, but it is called the biceps, bi as in two, brachii, because it has two separate ends here that insert into the muscle joint, the shoulder joint, excuse me. And then it actually inserts down here on the radius so that it can flex your arm, right? So it originates up here, it inserts down here. The fascicles are arranged in this direction. So when that muscle contracts, it shortens this way, which means that it's going to pull this point up towards itself, right? And we call that action flexion, right? It's flexing. Okay. So that's the biceps brachii on the anterior side of your arm, right? So in anatomical position, This is the anterior side of your upper arm. On the posterior side, we have the Triceps Brachii, and you might suspect why it's called the Triceps Brachii. Similarly, it has 3 heads, right? Tri, 3. So your Triceps Brachii is on the posterior side of the upper arm. We can see it clearly here. So it has 3 points of origin, again, up in the shoulder joint, and it actually, the tendon at the end of your Triceps Brachii wraps around the joint, your elbow joint, okay, so it wraps around that, the trochlear notch of the ulna, right? So remember, it's got the bottle opener, so that tendon wraps around here, and it's gonna be protected by bursae, right? And those, the bursae that protect the tendons, so that it can insert on the ulna, on the head of the ulna, so that when this muscle, whose fascicles are arranged again lengthwise down the humerus, when it contracts, it pulls this way, right? It gets shortened this way, and therefore it's going to pull the insertion towards the origin. It's going to pull like this, right? So it's going to do the opposite of flexing. It's going to pull, it's pulling right here, like that, right? Which is extension. So your biceps brachii, the action for your biceps brachii is flexion, right? It's a prime mover for flexion. And your triceps brachii is the prime mover for extension. Okay? Does that make sense so far? Muscles of the upper arm and shoulder. So far, so good, I hope. Okay, let me see what else we got over here with our lovely little interactivity. Okay, so here we're looking at looks like a anterior view here on the left. So this is the biceps brachii, right? And just below it, underneath it, you can see the brachialis. Okay, so see, I'm highlighting the biceps brachii here, and then I'm highlighting the brachialis just below it. So I'm not sure if we can, let's see if we can get to the brachialis from here. So we've got our biceps brachii, and if we dissect that away, how far does it go? Oh, cool, here's a really nice view of that, of the 2 heads of the biceps brachii here. Very nice. Let's see if we can dissect that away and find the brachialis underneath, shall we? Ooh. Hey, there it is. Okay, so there's your brachialis underneath the biceps brachii. Okay. The brachialis is going to be, since it's not the prime mover, right, for this flexion, it's, there's a special word for it, but I didn't ask you to memorize it, for muscles that help in an action, okay? So it's a helper muscle, all right? It helps the biceps brachii, but it's not the prime mover. I think it's like a secondary mover or something like that, okay? Question?
Is it what we call a synergist?
A synergist. Thank you, Joseph. I knew there was a fancy word for it. So this is a synergist, which basically helps the prime mover do its action. Awesome. Thank you, Joseph. Let's see if we can find, oh, well, duh, we already have it here. And there aren't really any deep muscles of the posterior side of the upper arm. At least not that I need you to memorize. So the triceps brachii on the posterior side of the upper arm, and the biceps brachii, which is the superficial muscle of the anterior side of the upper arm, and then the brachialis is just deep to the biceps brachii, okay, on the anterior side. And then the deltoid is, of course, superior and on the lateral side of the arm, okay. Moving down to the lower arm, unless you guys have questions. No questions so far? Okay, so this is where it gets a little bit more complicated in terms of being able to differentiate these different muscles. If I move on to page 409 is actually pretty nice. So it's actually got some nice illustrations. And if I take us back to our textbook, I'll probably be able to show you here as well. All right. The muscular system. Muscles of the forearm, muscles of the arm that move the radius and ulna. Might start there. Shoulder, muscles of the shoulder that move the radius or move the humerus, right? We just talked about. Here they are again, the triceps and the biceps. Different fascicle arrangements. Oh, here's our buddy. Okay. Oh, I feel like we're moving in the wrong direction. We want this of the arm that move the radius and ulna. Am I crazy? Why is it doing this? Yes. Okay. Okay, so this is what I'm looking at in our textbook right here. We talked about the muscles of the upper arm. This is obviously a deep view because we have the brachialis.
Definitely do it somewhere else. Okay, just wanted to make sure that you knew about the benefits also.
Questions, or do we need to mute us?
Yeah, so if so if she doesn't release me Wednesday, so it's basically saying you guys are gonna have to let me go because it's been over that.
We would need something saying.
Hey guys, we need to mute while we're.
Yeah, that's what I oh,
Anybody-
I'm sorry, go ahead.
Could you mute
You
your
don't have anything at all saying that you need to
Hey,
be off first.
no.
So
Vanessa?
for you to qualify for medical leave, which
Hey,
means
right
that,
up.
we would hit
No
the job
phone
and
during lecture.
doctor.
How do I like get her attention?
And that's what it is.
Hello? Anybody?
But they know this has been said, you know, and you know, I
Hey,
that's on my list, but
you.
you know, with that intense documentation, it's just that we don't have anything
That's
to
right.
show us that you've been,
I think you should
that
mute
is often
everybody.
have you out.
And it's
Yeah.
So we need to get that, and then once we have that information, being asked, you know, absent that, then it's just, you know, kind of a personal leave, which is
not my audio. Mute her audio.
Yeah. No, I understand. Because I also asked her also because during the time when she's like, oh yeah, okay, another 3 days, I'll check on you on these days.
I'm pretty
But I
sure.
let her know, I was like, well, is there any way you can give me something saying that, you know, I can't
Guys,
you
hey.
can't release me
Hello.
yet because you need these 3 more days or, you know, these more.
Okay. All right. Now it's working. I don't know why I kept hitting mute on her and it wouldn't do anything.
That was very interesting.
I'm crying.
I learned a lot from that experience. I learned that I can mute you guys individually if I open this particular view of it. Where was I? Holy crap. Wonder if is she like working? She sounds like she works in insurance or something. That sounds not fun.
Oh my god, that was funny.
What is this? This better be.
She said that you could kick users out as well, Ellen.
I know. I was like thinking about it. I was like, how do I do that? Because I've never had to do it before. So, because we've been so nice, we haven't had anybody like bombing our Zoom meetings and doing inappropriate things like I've been hearing about. But
That's
you
crazy.
guys are just pros, you know, most of the time. But hey, we all have our moments, right? It's it's not a perfect world. So this is actually a really nice. This is all of our lower arm muscles. So let's dive into these. Obviously, we're not going to be memorizing all of them. And I don't think we're actually looking at any that are particularly deep, none that you can't see from the surface as per our PowerPoint presentation, okay? So we've got firstly, I would say this one largest muscle, which is on the lateral side, right, in anatomical position. So it's on the side of your radius, right? It covers the radius. It's this big muscle right here that is going to be associated with your thumb, right? So if you look closely actually on this picture, this image, you can see that the tendon of this muscle, which is the Brachioradialis muscle, inserts all the way down here at where the thumb is, okay? So it's going to be associated with, I don't even think you need to know the action of the Brachioradialis. No, you don't, but it has to do with moving your thumb, in case you were wondering, okay? So Brachioradialis, let's see if we can, obviously we've got it right here. It is this big, chunky, large muscle associated with the thumb side on really the anterior side when you're in anatomical position, okay? Is the Brachioradialis. All right, I'm all discombobulated now. Okay, here we go. These are just the upper arm muscles. So let's go ahead and move on to our buddy here. See if we can see some of these lower arm muscles. Like this one. Yes, okay, so there it is. There's your Brachioradialis muscle, right? So you've got your biceps brachii, triceps brachii, and your brachialis underneath the biceps brachii. The Brachioradialis is this superficial muscle of the arm associated with the elbow joint and the thumb that is covering the radius, okay? So hence the name, Brachioradialis. It's covering the radius of your lower arm. And just medial to the Brachioradialis, you have the Flexor Carpi radialis, okay? So again, this is also a muscle that is associated with the radius, but it is just medial to the Brachioradialis. A little bit more difficult to see here because this guy isn't in like perfect anatomical position, right? They got him in anatomical position, but his arms are kind of airing inward there. But this is the Flexor Carpi radialis. And as you can see, the tendon for this muscle is going to be inserting at the wrist, and it is going to be allowing you to flex your wrist, okay? So it is a flexor. Remember that some muscles are named for their action, for what they do. It is a flexor. It is associated with the radius, right? And it's going to flex your wrist. So it's the muscle that pulls this way to flex your wrist, okay? And I don't think that that is on here either. Nope. Okay. So, but it's going to be that, it's going to be the one in the middle, okay? So your Flexor Carpi radialis is the one in the middle on the anterior side of your lower forearm, your lower arm, okay? And then the medial most muscle of the anterior side of your forearm is the Palmaris Longus, okay? And you can see, again, that this guy is associated with your wrist, okay? It is the long muscle. It is a long muscle, hence longus, right? It's a long, skinny muscle on the medial side here of your lower arm, and it is going to be associated with your palm, and it's going to be another synergist to the prime mover, that is the Flexor Carpi radialis, of flexing your wrist, okay? So it too is going to shorten this way and flex your wrist like this, okay? So those are the muscles on the anterior side of your lower arm that I would like you to know. On the posterior side, we've got a few more. You can again see the Brachioradialis from the posterior over here. On this guy, I'm wondering if we can even see the longus muscle. Oh, yeah, we can. Oh, yep, there it is, the Palmaris Longus. It's a little bit difficult to see on our dissecting guy because it's sort of wrapping around the back there because his arm isn't like all the way supinated, right? So, but you can see its tendon inserting here at the wrist, okay? And if we move posterior, out of curiosity, I wonder, will we be able to see it? Maybe not, and maybe if we dissect away a little bit. So let's see if we can get some of this, like this fascia out of the way, which is neat, but we don't need to see it right now. You can go now, fascia. So it's like, again, it's a connective tissue sheath, right? So this fascia is connective tissue that's covering the outside of the muscle. It's going to be the epimysium. Whoa, hello. We just dissected away all of our lower arm muscles. Okay, so that was really the only way that we could see that the longus muscle on the anterior side. So the palmaris longus, as seen on the anterior, is here, okay? But from the posterior, it doesn't look like we're able to isolate that without removing it entirely. So let's just move on to the muscles of the back, or the posterior side in anatomical position of the lower arm, okay? So here we go. On the back side, again, you can see a little bit of the brachioradialis. Now, instead of having a flexor carpi, on the back side, we have an extensor carpi, right? Which makes sense. So you have a muscle on the front, the flexor carpi radialis, which is going to, when it contracts, shorten and flex the wrist, right? And on the back side, you have an extensor carpi radialis that when it flexes and shortens, it's going to extend the wrist, okay? So prime mover, flexor carpi radialis for flexing the wrist, and then you have an extendor carpi radialis to be the prime mover at extending the wrist, right? And then vice versa, the opposite is going to be the antagonist in that muscle pair, okay? So you've got the prime mover here, the antagonist back here, prime mover here, antagonist up here, okay? All right, so that's our extensor carpi radialis longus. We have a flexor carpi ulnaris, which is going to be over here on this medial edge from the back side, okay? So this is associated with the ulna, right? So this is going to be pulling your wrist in a lateral, actually it would be a medial direction according to anatomical position, right? So when this muscle shortens, you're going to be flexing the wrist in a medial direction, okay? So it is technically a flexor. The flexor carpi ulnaris, again, associated with the ulna, which is on the side of your pinky, okay? So it's this muscle right here that when it contracts, it's going to be pulling like this, okay? And then finally, the extensor digitorum is going to be in the middle. There is a little muscle, oh, never mind, that's the flexor ulnaris. There's a muscle in the middle called the extensor digitorum. And this guy is, as you might suspect based on its name, is going to extend the digits, right? So you can flex your digits like this, and you can extend your digits like this, and it's going to be that extensor digitorum that is going to be pulling to extend your fingers, your digits, okay? So your extensor digitorum is going to extend your wrist and your fingers as well, your hand, okay? Let's see how many of these we can identify on our delightful little friend over here. Let me make sure that I have a posterior view over here. Okay. All right. So the extensor, what I'm not sure about is whether I'm going to be able to see these guys with that fascia in the way. Why they dissect away the muscles with the fascia, I am not sure. Can I get any of these guys individually? Oh, here we go. Here's the extensor carpi ulnaris. Okay, so that is going to be that one in the middle. Okay, so it's going to be that medial muscle there. Seeing if I can find the flexor carpi ulnaris. There it is. Okay, so this is the flexor. Let's see if I can find that extensor in the middle. And then finally, the extensor carpi radialis longus. Since this is associated with the radius, I'm looking for it over here on the side of the thumb. Nope. Extensor digitorum. And it looks like I may not even be able to, maybe I can get it from the front here. There we go. Okay, so the extensor carpi radialis is here, and the flexor carpi radialis should be Palmaris longus. There we go. Extensor, nope, I want the flexor because it's dissected away. Okay, here we go. Flexor carpi radialis. So the flexor carpi radialis on the front, on the anterior side, actually looks like it covers up the extensor radialis. Or what you can see of it from the front. I don't need to see the nerves. Okay. Extensor. Flexor, nope. I want the flexor radialis. There we go. Okay, so here we go. So the extensor, so on this dissected guy, you can see them both from the anterior view. So the extensor carpi radialis longus is here, and the flexor carpi radialis is here. Okay. Okay. Oh, the flexor carpi ulnaris was what I was looking for, wasn't it? There we go. Right. Okay. So ulnaris, as in associated with the pinky finger, right? So that's the muscle on the pinky finger. The muscles that are associated with the radialis are going to be on the side of the thumb. And then you've got longus muscle on the anterior side, Palmaris longus, which inserts at like the center of the wrist. That's how you're going to be able to identify that one. It's the one that comes down to the middle of the wrist right here. And then finally, in the middle on the posterior side, the extensor digitorum. So it's kind of like the Palmaris longus is the flexor for your digits going this way. And on the posterior side, the antagonist for that motion is the extensor digitorum. So see how these tendons of that muscle extends all the way down your hand to extend your entire hand, while on the front side, that Palmaris longus, well, you can't really see it very clearly here, but it does extend into your hand, into the palm of your hand, hence Palmaris longus, right? So it actually helps you to flex and close your hand. So those two are paired off to flex your hand and extend your hand. And then they are actually synergists for the prime movers, which do this flexion extension motion, which are going to be your Brachioradialis, your Flexor Carpi Ulnaris, and your Extensor Digitorum, okay? So that's basically 3 muscles on the front side and 3 muscles on the back side. And you don't even need to know their actions. I'm just telling you for your curiosity or clarification. The muscles, it's the muscles of the upper arm that you need to know. So the biceps brachii flex and the triceps brachii extend. Okay, and that's it for the arms. Any questions about the arm muscles before we move on to the legs? I'm gonna move on to the leg muscles. Okay, taking that as a no. I'm moving on in my textbook to page 425. Let's see if that goes along with the e-text. Okay. All right, so I'm looking at figure 1120, 11.20. This guy right here, pretty cool. So let's get back to an anterior view on our buddy here and start up here at the hip joint, at this junction, right? You can see the iliac crest poking through here. So the pelvis is underneath all these muscles, right? Obviously, you can see the iliac crest poking through here on the side, and you can see the pubic symphysis poking through here on the anterior side as well. So you've got some muscles here that are that live beneath some of these muscles of the abdomen. Okay, so like the external oblique here, this guy goes up basically into the bowl of the pelvis to allow you to basically flex your hip. Okay, so it allows you to draw your leg up like this. Okay, so it pulls right here by originating at or around the iliac crest and inserting at the top or near the top of the femur here. Okay, so let's see if we can find some of these guys, or if they get dissected away before we dissect away the muscles of the abdomen. Still dissecting muscles of the abdomen. Oh, so we lost the rectus abdominis here. I see we have transverse abdominis just beneath this connective tissue sheath or layer right here. You're gonna hit the viscera. So we've basically removed most, if not all, of the muscles that we can here before we get to internal organs. And you can see how this guy right here, which should be your iliopsoas muscle, maybe it's is it called something else? Hang on, let me make sure that this isn't the same thing, but just being called by another name. Even when we're dissecting the rabbits, I noticed they look different. Like every rabbit looks a little bit different. So every human looks a little bit different in dissection, I assume. Oh, okay, right. So the iliopsoas muscle is actually considered to be both the iliac muscle as well as this other little one right here, the psoas major. So basically they didn't, they haven't they don't have a specific, they didn't like specifically identify the iliopsoas muscle in this dissection, I'm finding out. So they actually like put it in with the iliacus muscle, unless it's deeper or something. Nope, I think that's about as deep as we're gonna get. We hit the bladder over here, so hello. Oh, check it out though. If you keep dissecting away, it looks like we might be able to check that out. Okay, so look at this. This is actually really cool. We were able to see the what is the iliopsoas muscle coming up here, as well as a couple of other synergists, which together are called the iliacus muscle. But I will accept iliopsoas for anything within this group that they're calling the iliacus muscle. It originates again up here on the iliac crest, so it's literally following that edge of the iliac crest up here. It is like behind the viscera of your pelvic cavity, right? So it's like it's back here. All of your intestines and stuff are like anterior to it. It comes up out of the pelvis over the ilium, right? Over the ischium, excuse me, okay? And then it wraps around and inserts up here at the upper mid femur, okay? So it's up here at whatever bone marking is here that we didn't specifically have to know. And when it contracts, again, along the fascicles, along those muscle fibers, it's going to contract lengthwise, and it's going to pull your leg up like a marching kind of a thing, okay? So it is like deep inside of the hip, attached on the inner edge of the iliac crest, and inserting on the femur here, so that when it contracts, it is pulling your leg up like this, okay? So that you would consider that to be flexion of the hip, okay? So you're flexing the hip here. The muscle that would extend the hip, therefore, is going to be your gluteus maximus, right? Okay. So when I ask you about the iliopsoas, I will accept anything that is within that this iliacus muscle like group that it's basically been kind of like mashed in with over here, okay? All right, so now I'm gonna have to add in a bunch more stuff because the rest of our muscles have been dissected away now. Okay, getting into some more of them. I think I need just a little bit more. Okay. So we're gonna consider this the iliopsoas muscle on this dissection. The psoas major is not one that I'm asking you to know. So let's move on to one that again isn't there. There we go. The Pectineus muscle. Okay, so you've basically got what we're going to consider the iliopsoas here and the pectineus here. Iliopsoas here, pectineus here. Okay, these two muscles right here, which are going to be used to flex the hip. Okay, so you're basically like raising your knee up. Okay, if you raise your knee up, you're going to be using your iliopsoas and your pectineus muscles here. And these two muscles are deep to this long, skinny, superficial muscle right here, which is your sartorius. It's labeled on the other side, okay? So this long, skinny muscle, which inserts up here at the anterior superior iliac spine, right? And then, or originates there and inserts over here on the side of the knee. When it contracts, it's going to help you to rotate medially this leg, okay? So that sartorius muscle is coming from here to here, okay? All across the front here, So when it contracts this way, it's going to be pulling the leg around in a medial rotation, okay? And let's see if that is on your thing. Sartorius, Sartorius, Sartorius. Flex, abduct, and laterally rotate the thigh, okay? So you're going to be, it's going to be a synergist for that flexing that the Iliopsoas and the Pectineus are doing. So your Sartorius is going to be a synergist for that. And it's going to help you to rotate your leg, okay? So you're gonna, when it pulls, it's going to be rotating your leg inward, okay? I'm not sure why it's called laterally, why it's saying it's rotating laterally. The Gracilis, out of curiosity here, would be medially rotating. Okay, so I guess it's basically pulling your knee towards your hip. So you would be, when it's contracting, you would be basically pulling like this, pulling your knee out towards your hip like that, contracting like this. Versus the opposite or antagonist of that would be your Gracilis muscle, which is this medially, this medial most upper leg muscle. That's going to be doing the medial rotation. So that's going to be rotating your knee inward. Okay, so Sartorius is laterally rotating. Your Gracilis is medially rotating. It's going to be doing the opposite of whatever the Sartorius is. The Sartorius is going to help to abduct your leg, right? So you're going to be removing it from the midline. And then your Gracilis is going to adduct it, which is adding it back to the midline, okay? Let's see if we can find them here. Okay, we actually need to add some muscle back here because we have dissected down past them. Ooh, look at that. How cool is that? This is a nerve. Nope, it's your femoral artery. Crazy. Crazy, and I love it. It's not as fun as dissecting rabbits, but it's still pretty cool to be able to see all these things. Okay, so we've got the Sartorius just landed, and then there's that, but we don't have a Gracilis yet. There we go. Okay, so here's your Sartorius, which would help you to rotate your knee outward. Okay, so basically if you rotate your kneecap outward, that is going to be your Sartorius working. And then if you were to rotate your knee back inward, your Gracilis would be doing that, would be pulling your knee around and inward, okay? So basically, you've got Sartorius out, and then your Gracilis is going to pull it back in. Your Sartorius is also a synergist for abducting your leg, and your Gracilis is going to be adducting. Woo, I'm gonna fall down. Adducting your leg, okay? So adding it back to the midline. Moving away from the midline, Sartorius, adducting to the midline, Gracilis, which is on the inner thigh, okay? Okay. How are we doing? We still doing okay? Upper leg muscles. Get a little bit fun. Iliopsoas, Pectineus, Sartorius, Gracilis. Now let's talk about, one more, the Tensor Fasciae. Latae. Okay, so this guy is going to be really it's going to be helping you to flex your hip as well as abduct your leg, right? So if this guy contracts along its fascicles, again, right, it shortens along this length, it's going to pull the leg up and out this way, right? Or forward towards us in this image. And I don't think we need to know that either. I don't see it, so no. Don't worry about the action of the Tensor Fasciae Latae, that it is this lateral muscle. We have the Gracilis as the most medial muscle, the Sartorius as this long, skinny, sort of belt-like muscle, which is coming up and over and around the front of the leg. And then the deep muscles, the Iliopsoas and the Pectineus muscles here. We've got a long, skinny Adductor Longus, just lateral to the Gracilis. So here's the Gracilis. The Adductor Longus is going to be another one that's going to, again, adduct your leg. So we have lots of muscles that are working together to do the same action, right? So it is named for both its action and its shape, right? So it's a long, skinny muscle, and it is adducting. And you can see that it dives deep below the Sartorius and the other quadriceps muscles, which we're going to get to right now, okay? But you can see it superficially, therefore it is included in your reference picture here, okay? So remember that the Gracilis is the one that is the most medial, okay? So it's the inside of the upper thigh. The Sartorius is going across and over the front. The Tensor Fasciae Latae is basically on the opposite. It's on the lateral side compared to the Gracilis. And those are your uppermost leg muscles that are associated with your, superficially at least with the pelvis. We do have now our quadriceps muscles. So your quadriceps muscles do include 4 separate muscles. On your coloring book, I'm trying to remember if I made a mistake and got rid of one of your quadriceps muscles, which wouldn't be the end of the world, except that I just worry about you guys being confused about why they're called a quadriceps muscle when you only have to memorize 3 muscles, right? So quad would imply that there are 4, which is true, of course. There are 4 muscles of your quadriceps. And on your human body coloring book lab assignment, which is downloading, sorry. Download. Includes 1 muscle that is deep to the rest, so you can't see it in a superficial view. But I'm wondering if I was smart enough to not exclude it here. Nope, I've got it. It's just not on this. Okay. So I'm gonna have to add 1 more here. I'm really sorry. Forgive me, you guys. I need to add 1 more here. For it to be a proper quadriceps, you have to have 4 muscles there, right? It is the rectus intermedius, if I'm not terribly mistaken, vastus. Okay. Ugh, don't do that. And the vastus intermedius is deep to what we can see here, which is the rectus femoris. Let's do this. Deep to the rectus femoris, okay? Let me help to clarify this a little bit over here. All right, so your quadricep, when you think about your quads, right? You think about these muscles on the top, on the anterior side of your upper leg, right? And you can see 3 of them here superficially, okay? You've got your rectus femoris right here in the middle, okay? So that is the middle one. You have a vastus medialis and a vastus lateralis, okay? Here's our tensor fasciae latae extending all the way down to the side of the knee, okay? So just medial to that is your vastus lateralis, vastus medialis, rectus femoris, and just deep to the rectus femoris, if we dissect down a little bit, here we go, we should see the vastus intermedius, okay? So the vastus intermedius is deep to the rectus femoris. The rectus femoris lays right on top of it. Is that clear what I'm doing here? We've got the vastus intermedius, just deep to the rectus femoris here. And then on the medial side, you have a vastus medialis, and on the lateral side, a vastus lateralis, which is nice, okay? Those are your 4 quadriceps muscles on the anterior side of your upper leg, okay? And if we move down to the lower leg, save this and do that. We've got the Tibialis Anterior, which is a great name for a muscle that is on the anterior side of your tibia, okay? So your Tibialis Anterior muscle, your tibia, of course, is really like right at this seam right here, because you can feel it through your skin, right? So you can feel that the ridge of your tibia right there. So it's just lateral, really, to the edge of your tibia, but it is considered the tibialis anterior muscle because the tendon wraps around across the front of it, down into your foot, okay? So your tibialis lateralis, tibialis anterior, here it is, contributes to dorsiflexion, right? So we remember that we had palmar or, gosh, dang it. Flexion of your foot as in pointing your toe, right? So you had plantar flexion as in pointing your toe. And then we had dorsiflexion, which was like turning your foot, angling your foot inward. And dorsiflexion, which is like turning your foot out laterally, right? So we have dorsiflexion, moving your foot inward, okay? Kind of like how this guy is naturally. He's kind of pulling the palm or the sole of his foot towards the middle, okay, like in. That movement is because this muscle, although it is on the lateral side of the tibia here, the tendon reaches down to the medial side of the foot. So when it pulls that medial side of the foot up, okay? So it pulls the inside of your foot up. In addition, we have the Fibularis Longus, which is on the most lateral edge of your lower leg, okay? It is, of course, going to be over your fibula, which, as we know, is on the lateral side of the tibia, right? So it's going to be a long muscle over the fibula. Let's see if we can see it from here. We'll probably do a lateral view. There we go. Okay, so this long, skinny guy is going to be your fibularis muscle, okay? And then in between the tibialis anterior and the fibularis, this little strip here, is your extensor digitorum longus, okay? So remember we have extensor digitorum on the posterior side of your lower arm, which is going to extend your digits of your hand. You also have an extensor digitorum longus muscle of your lower leg, which is going to help you to extend the digits of your foot. So see how it extends all the way down to your toes, and that's going to help you to extend your foot, right? So you're pulling this muscle, yeah, all the way over here. You're pulling this muscle like that, okay? And it's pulling all of your toes towards itself, okay? Towards your knee is where that guy is gonna be contracting right there, like that, okay? So those three muscles on the anterior side is what you need to know. See how it wraps around the front here. So you had, again, Extensor Digitorum Longus, the Tibialis Anterior, and then finally that Fibularis muscle, and we're just calling it the Fibularis Longus for our purposes. Let's see, what's it called in your coloring book? Fibularis Longus, okay? So in Wiley Plus, we call it the Fibularis Brevis. Okay. Oh, no, there's the longus, sorry. Okay. So there's the Fibularis Longus all the way on the lateral edge. We are ignoring the Fibularis Brevis for now. It's just a little synergist, it's a little helper muscle. Focus on the Tibialis Anterior, the Fibularis Longus, and in the middle, the Extensor Digitorum Longus. Okay, so that's from medial to lateral, Tibialis Anterior muscle, Extensor Digitorum Longus muscle, which extends down to the foot, and then the Fibularis Longus muscle, which covers the fibula over here, right? Okay. And as far as the actions for those guys go, it's just the Tibialis Anterior, that largest muscle on the anterior side of your shin, really, just lateral to your shin bone, is dorsiflexion, okay? So it pulls the sole of your foot in towards the midline, okay? On the posterior side, back here, wait, did we get everything? Well, we can see the gastrocnemius from here, so we might as well mention them. So those guys are on the lateral side of the anterior side of your lower leg. On the medial side, you have the soleus, this little guy here, and then your calf muscle, your actual calf muscle as you think of it, is called the gastrocnemius, okay? So your gastrocnemius is this great big muscle right here, and you've got this little guy, the soleus, who is another little synergist. And I wonder if we can see him from here. Okay, so on the anterior side, we can see the soleus muscle. Okay, so we're going to be doing, this is a synergist for the gastrocnemius, okay? So your gastrocnemius, which is in the back here, and has been cut away partially. Let's see if we can get him back. Here we go. Okay, no, I want the whole thing. Bring it back, there. Okay, so here's your calf muscle, the gastrocnemius. This guy is the prime mover for plantar flexion, okay? So this guy is involved with pointing your toes or standing on your toes, right? And then you've got a little synergist here on the lateral side of your gastrocnemius called the soleus, okay? So it's just a little synergist muscle helping out your gastrocnemius for plantar flexion, okay? And the plantar flexion part is the part that you need to know for the gastrocnemius in particular, okay? So that's the muscles of the anterior of the leg. Any questions before I move on to the posterior of the leg, the back of the leg? Okay, here we go then. All right, so first of all, of course, we have the Gluteus Maximus, right? Which is going to be involved in extension of the hip. It is going to be originating again at the pelvis and the sacrum, and then it inserts all the way down by your knee so that you can extend your hip, which is basically like going from the opposite of what your little iliopsoas muscle does up here it's going to be doing the opposite. So it's the antagonist for flexing the hip, right? Your gluteus maximus is going to extend your hip like that. The synergist for your gluteus maximus is your gluteus medius, which is just deep to the gluteus maximus, okay? So let's see if we can find this guy's gluteus medius here. I know we had a little bit of trouble the last time. I think I talked about the gluteus maximus and medius last Thursday. So here's our gluteus maximus, of course, right? So when this flexes, it's going to pull this leg back towards us. And if we dissect it away, the gluteus medius is just deep to that, okay? So it's going to help the gluteus maximus with extending the thigh. And it's going to also abduct and medially rotate the thigh by pulling here, bringing this leg out this way, okay? So if the gluteus maximus is going to be pulling the leg back, the gluteus medius is going to also pull the leg back a little bit, but also to the side. So it's going to be abducting the leg a little bit, right? So your gluteus maximus is doing this, and your gluteus medius is doing this, and also with this medial rotation of the thigh, okay? So you have lots and lots of muscles because and that's the reason why you have lots and lots of very subtle ways that you can move your skeleton, right? It's because of having all these different muscles. If you only had a gluteus maximus, then you wouldn't be able to do a very specific movement that's required to like rotate your knee inward while moving your leg out like that, which probably would affect your ability to, like, I don't know, dodge. Maybe not run so much, run a little bit, but like maybe dodge things, like run back and forth or in a zigzag or something. Okay, so gluteus maximus, gluteus medius, and then moving down, we can see the gracilis from the posterior. I don't have it labeled here, but this is the gracilis again, right? So that's like this guy all the way over here. We can see the gracilis. Hey. No, we're not doing this right now. How dare you? Okay, we've got the Adductor Magnus, okay? So that's this little guy right here, this annoying little dude. Let's get our, oops, go wrong way. Let's get our gluteus maximus back. Let's see if we can see our Adductor Magnus. Here we go. So as you might suspect from its name, this guy is the prime mover for adducting your leg back, right? So your gracilis and your Adductor Magnus together. There we go. So here's your gracilis, long, skinny gracilis reaching all the way up from the pelvis down to that medial side of your knee. And the Adductus Magnus, or the Adductor Magnus, those two guys combined are going to adduct your leg, right? So that's literally just adding your leg back, pulling to add your leg back to the midline, okay? So adduction for your Adductor Magnus. I do not believe that you need to know that. No. Okay. But that's this little guy right here. And he actually lies deep. Or actually, no, he's just kind of parallel. There might be some, your hamstrings might overlap your Adductor Magnus a little bit. It's hard to tell here. But let's talk about your hamstrings, okay? So your hamstring muscles on the back of your thigh include 3 different muscles, okay? You have your biceps femoris on the lateral side, your semimembranosus on the medial side, and your semitendinosus right in the middle. So let's look at this guy, because this guy has it much clearer, I think. And your dissection guy on Wiley Plus has your hamstrings Everything else is a little bit, I feel like, more confusing, but your hamstrings is very clear. So here's your biceps femoris muscle, right? Your semimembranosus on the medial side, and then right in the middle, your semitendinosus, right? So while your quadriceps muscles in the front, right, your vastus medialis, vastus lateralis, rectus femoris, and your vastus intermedius underneath that are going to be involved in extending the knee, right? So that's going to be how you straighten your leg or extend your knee, right? So your quadriceps muscles, when they pull, they straighten your knee, right? They are the prime mover for straightening your knee, and they are the antagonist for bending your knee, right? The prime mover for bending your knee are your hamstring muscles on the back of your thigh. Okay. Okay. Let's go back and see them again. Okay. So your three hamstring muscles are your semimembranosus, semitendinosus, and your biceps femoris. Okay. These three right here are all involved in extending the thigh or flexing your leg. Okay, so let me explain real quick the difference between extending the thigh and flexing the leg again. So I've been calling it extending the hip, flexing and extending the hip. So remember that little iliopsoas muscle that's deep down in here that helps you to flex the hip? Basically on that chart it says it's flexing the thigh. That's the same thing, flexing the hip and the thigh. You're flexing this joint right here, okay? So you're flexing that hip. Gluteus Maximus is extending the hip or the thigh. And your hamstring muscles are also going to help to extend the thigh, as well as flex the leg, which is basically bending your knee, okay? So when you flex your leg, you're bending your knee. So it's going to be bending your knee. Extending the leg is what your quadriceps does. You're extending the knee joint, okay? Extending the leg versus extending the knee is the same darn thing. Maybe I'll add that in. Extend the leg, knee, and thigh, hip. Maybe if I just do this instead. So when it says to flex the leg, it's talking about the knee joint. And I find that it's easier to refer to actions in terms of the joint that's involved. So I hope that this is helpful for you too. It's just how it's helpful to me. Okay, so maybe it'll help somebody else too. Okay, all right. Okay, so those are your hamstrings. So those are the muscles of the posterior side of your upper leg. On the lower leg, we're going to revisit a couple of friends from the anterior side because you can see them from both sides. Your gastrocnemius, which is your calf muscle, your soleus, which is your little helper buddy, and let's see if we can see those guys from the posterior angle again. Gastrocnemius, soleus, our little synergist friend, both involved in plantar flexion. Gastrocnemius, soleus. The Fibularis Longus you can see from the posterior side as well. You can see it even better over here. There we go. And out of curiosity, plantar flexion everts the foot. Yeah, plantar eversion or dorsiflexion. And then finally, the only tendon that I need you to know out of all of these is your calcaneal tendon, because it's so super important and can be injured so often. You're going to see these injuries a lot. So your calcaneal tendon is your Achilles tendon, right? It is your Achilles heel. So that is the tendon that attaches your gastrocnemius muscle, your calf muscle, to your calcaneus or your heel bone, okay? So on our friend over here, it's gonna be, see if it's separate, sure is. So there's your calcaneal tendon right here, which is going to originate over up here. Actually, it's part of your gastrocnemius muscle, right? So your calf muscle, because it's a tendon, it's attaching muscle to bone. So it's going to, that muscle is going to originate up here at the top of the tibia, and it inserts at the calcaneus, your heel bone, right? That big short bone of your heel, that big tarsal bone, right? And when your gastrocnemius contracts, you're going to pull that calcaneal tendon, which pulls your calcaneus bone up towards like the back of your knee, right? And that's what happens when you're pointing your toe. So your gastrocnemius muscle is continuous with your calcaneal tendon. Your calcaneal tendon connects your gastrocnemius to the calcaneus bone, okay? Muscle to bone tendon, right? As opposed to a ligament, which attaches bone to bone, right? Which we don't need to know any of. We don't need to know any of the ligaments. Okay, so that's pretty much it. Those are the muscles of your arms and legs. You've got 3, 4 technically major guys of your upper arm, deltoid, biceps brachii, triceps brachii, and your brachialis underneath your biceps. And then in your forearm, you basically have 3 in the front, 3 in the back. And then on your legs, for your upper leg, you've got some of these deep muscles here that are going to be helping you to flex the thigh or flex your hip right here, right? Your iliopsoas, which was called the Iliacus, was the Iliacus, I believe, on our friend here. And it is, yeah, so these guys are very deep, right? It's very interesting. So they just cut the Sartorius. Okay, so while we're dissecting, we've got the Sartorius muscle here, the Gracilis muscle here, the Adductor Longus muscle here, between the Gracilis and the Sartorius. And then deep in here, the Iliacus, which we can only see this much of on this guy, versus in this illustration, we can see a little bit more of it here. Okay. But if you dissect away everybody else, you start to see where that Iliopsoas muscle inserts and originates, which is way deep inside of the pelvis. If you dissect away enough, you can find it. And there it is. Pretty awesome. Anyway, the Pectineus muscle, which we did see a little bit of over here. Wiki. They didn't identify it in that level of dissection, I guess. Your Pectineus muscle and the Iliopsoas or Iliacus muscle, these guys are going to be flexing your thigh or your hip, right? And moving down, our quadriceps muscles at the front. So quad is in 4, right? Vastus medialis, vastus lateralis, rectus femoris, and then just underneath the rectus femoris, you have a vastus intermedius. Okay, so we're actually looking at the vastus intermedius here, vastus lateralis, vastus medialis. Okay, so these 3 vastus muscles are 3 of the quadriceps, and then the rectus femoris Not there yet. Boom, makes 4. Okay, 1, 2, 3, and 4 underneath. Moving down, we have the gastrocnemius and the soleus on the medial side, the tibialis anterior, the extensor digitorum longus, and the fibularis longus on the lateral side, which from the back, you can again see the soleus and the fibularis longus and the gastrocnemius. And now we can see the calcaneal tendon, okay? Let's get our gastrocnemius back here. Come back here, you. Okay. Gastrocnemius, calcaneal tendon, soleus, fibularis longus, which you can also see. No, maybe not. Nope, can't see from the front on this guy. The extensor digitorum longus is the one that comes around to the front. Extensor digitoris longus right here. And if you follow it, you see that it actually leads to all of these tendons here, which are on the top of your foot, right? And that's just why it extends the digits of your foot, extensor digitorum, and it's a long skinny muscle. And the tibialis anterior, this big guy right here. From the front, we can see the gastrocnemius, and the soleus right there, okay? Whew. So those are the muscles of your arms and legs. Don't forget that you can use this guy to quiz yourself. And if I'm not mistaken, you can even specify, yep, your limb muscles. So you can specify the lower limb, upper limb versus the head and trunk muscles. But quiz yourself on all of them now, because we've looked at all of these muscles, all of these groups. So choose all of these to quiz yourself on your muscles. I will be using this dissection guy for your lab practical, okay? I'll basically have this dude zoomed in to whatever part, say it's your trapezius muscle. I will have the muscle visible naturally, and I will have the muscle highlighted like that. And I'll basically be like, what is the name of the highlighted muscle? Okay. So I'll just take a screenshot of this, and this will be what you'll see on your lab practical. You know, what is this muscle? What is this muscle? What is this muscle? What is this muscle? So make sure that you quiz yourself on all of these, okay? You can practice. This is actually a kind of a cool exam because you can practice it through Wiley Plus all day long. Kind of neat. And what else? Don't forget to do your coloring book stuff. I think I have them due on the 14th, but I'll extend that since we pushed the exam back. Let me write that down. What else, you guys? What else am I forgetting? Extend labs 7th through 19 due dates. You will have a quiz this weekend. I have time. We have time to talk about this on Thursday, but Thursday is going to be a open office hours Q&A session, which I will record if anybody shows up. Okay, so if nobody shows up and asks questions, obviously there's no point in recording it and posting it. So I might as well mention this now in case it doesn't get mentioned. You do have a quiz 10, excuse me, this weekend, which will be on muscles. More muscle stuff, but not the not muscle tissues like quiz 9 was. And the exam has been postponed by a day, right? So we're basically, the exam will be opened Friday morning at midnight, and then we'll close Monday night at midnight. So, or 11:59, okay? So don't miss out on that. The quiz is at normal time. It'll be the normal time for that. What in the heck am I looking at here? Okay. No. I scroll through this and it freaks me out because it's so long. Like, look how far we've come. This is just insane. Okay, week 12, week 13. I'm sorry, that was my mistake. So it's quiz 11. We just did quiz 10 up here, right? Quiz 11 is this weekend. Same time as your lecture and lab exams. I will post our video, this video here shortly, and it'll show up right here. Your assignments are all up to date. In assignments, I will extend the due dates for those. Exam is on Friday. Office hours on Thursday. I'll come back at 5:30 in case you guys think of questions right now. Maybe pull out your coloring book and see if anything in the arms and legs like doesn't jive in your brain and let me know. Or ask questions in the discussion. I've got a very nice little muscles discussion happening over here. So check that out and ask me questions here. We can help each other out with that. And this is our third to last lecture, you guys. We're gonna have an office hours on Thursday, and then we're gonna have a lecture on Tuesday and Thursday next week. And then we'll have finals, and then that'll be it. Like we're getting close to the end. So like I was saying, push to the finish. I'm glad that you guys are still here, all 12 of you. I'm hoping that everybody else is watching these after the fact. I assume they are, because pretty much everybody is still taking their quizzes and is on board, which is nice. So you guys are doing great. We're almost there. If you don't have any other questions, then...
Have you heard anything about fall semester yet, Ashley?
Oh God. So what I've heard about fall is that they want all lecture courses to be online. So that means that at the very most, we would have a face-to-face lab and then go home and have an online lecture, which is really weird, which would be really weird. They said that they are going to try and figure out how to do face-to-face labs for classes that have a lab in which we can adhere to social distancing practices. So if there is some way, if there's some way that the department can figure out how we can do our labs while also maintaining, maybe we'd have to come in and be wearing masks, probably have to decrease class size, or maybe like have multiple meetings with smaller groups of people, in whatever way they need to make it so that we can meet but also be safe. Then we will have Bio 50B in the fall. If they decide that it's not feasible for us to meet and also keep the social distancing requirements, then I'm assuming that they're going to postpone it. And I don't know what they're going to decide on that.
What's the time of the class will be on fall? Could you repeat that?
Fall, it'll be an evening class. So it'll be like I think it's a 5 to 6 lecture and then a 6 to 9 lab or something like that. Yeah, it's a nighttime deal. So if we even end up having it at all, I would be recording a lecture. I probably will just record the lectures and not even do a live thing. I'll probably just have the lectures pre-recorded and then posted for you guys. And basically the lecture part of the class will be, watch this video of me lecturing. In which case, of course, I would incorporate office hours and stuff for you guys to ask questions and stuff. But the only way that we can have the class is if they can figure out a way for us to have lab in person, but also safe. So if they decide that it's safe for us to come to lab in smaller groups and maybe wearing masks and gloves or whatever, then we can do it. But I have no idea if they're gonna be open to us doing smaller class sizes and stuff like that, which would suck anyway, you know, like hopefully, obviously we want everybody to be able to move on together. So I have no idea how that's gonna work out. I have no idea. work out.
That's gonna be tough. I mean, it's just this whole thing.
It's messy.
I mean, groceries. Groceries still going to, buying their stuff. Why can't we just have a class? Like,
Right? I know. I personally, I wouldn't mind, like, if they, like, ideally, if they paid me, that would be really nice. But I wouldn't mind, like, doing multiple lab sessions with fewer people, like split it up into 2 or 3 so that we're all not all packed into that lab together. And then if we just wear masks and not touch our faces.
so if they don't, so basically, if they don't figure out how to do our lab,
They won't do it at all.
they won't do it at all. Okay.
Yeah. Lectures are going to be online only. That is for sure, from what I understood from my most recent email from, I guess it was the chancellor or whatever, for Riverside County. They decided that no in-person lecture classes are going to happen, but they left leeway for the classes that have labs on the condition that we're able to do a lab and also maintain health standards of some sort. I don't know if that means like a 6-foot social distancing thing, because that would be really tough, It'd be like, well, if we had 1 person per lab bench and we all stayed 6 feet away from each other, I guess we could pull it off, but that just...
Right, but we're all going to be touching like the same,
We're all going to be
like,
touching the same stuff.
right.
Yeah.
So that, in a sense, that kind of does stink a little, because especially those of us who are like depending on this class to be able to apply, you know what I mean? Like, we're done.
It's killing. I know.
Families depending on this, like, that's the hardest part. So I hope it works out.
Yeah.
I hope we could take you in the fall.
I mean, if I'm teaching another in-person class in the future, and I'm optimistic that that will happen eventually, I'm going to make sure that it is the 50B class, so that at some point, I mean, obviously, if they're going to offer it, then I'm going to be teaching it. That's it. But what I'll do is, I'll dig into it a little bit. I'll go to our next department meeting, our next department Zoom meeting, and I'll bring it up. I'll say, hey, our anatomy kids are like really concerned about not getting part B.
Yeah.
On time.
If we do the lecture online, how about your exams? Like, are we going to be able to take our labs, like tests, like there with you, or?
I would probably do the lecture exam online, just because the lecture will be online. And then if we're allowed to have lab in person, then I think it would be awesome to do an actual lab practical. I don't see any reason why it would be any different than meeting for lab to look at it in the first place, so we might as well have a practical. It'll be nice to see you guys in person at all, so you can ask your questions like in person. And it might, it might be actually a really good, it probably would be better to have, obviously it would be better to have some part of it to be in person, but it'd be really nice to not have to just have office hours be in a Zoom format. So I'm really, really hoping that they're gonna like try and be creative and figure it out for you guys. So I'll put in a word to like the department at large and the chairs and just be like, hey, I know because she's the department chair. Dr. Gutierrez she's a microbiology person. So I don't know how super aware she is of the anatomy and physiology people, but I do know that she's very close to Peggy Campo, who's like the OG anatomy and physiology instructor. So I'm sure Peggy is freaking out. I'll probably email Peggy to start with.
Okay.
To see what she thinks is gonna be happening. Just to be like, hey, what do I tell my students? They're asking me, So
yeah, especially because we're gonna be applying or for the nursing programs. So we need to know if we're able.
Right? That's gonna be like January, February. Those applications need to go out, right?
Yeah.
Yeah. I'm sorry, I don't know any more details.
No, that's okay.
Thank
you.
Just sucks.
You'll be our voice. We appreciate it.
Oh, I'm gonna try. I'm gonna speak out. They're all like super stressed out and crabby right now, so I'm like trying to like not bug as much as I can. But they, maybe like a little bit closer to the end of the semester, I think we had like a really rough patch there where we were having to like comply to accessibility stuff. I think there was a deadline that went by or something where they were like really crabby and not like wanting to be emailed and stuff. So I think that's over. So I'll email Peggy and see what she has to say about that. And worst case, I'll go to the anatomy the biology, the science department meeting, faculty meeting, and bring it up there if I have to, which I will do for you guys. I'll do it for you.
Okay, thank you.
No problem, you guys. I'll see you at 5:30 if you think of anything. Otherwise, I'll hopefully see you on Thursday for office hours, regular time, 2 p.m. And then Thursday night, Friday morning, midnight, right? That's when your exams are gonna go up, as well as your quiz. So you'll have the weekend through Monday for the exams. I'll extend the quiz through Monday too, just so it's not too weird and confusing.
Okay.
11 through Monday. And then we can talk about eyeballs on Tuesday. Yay! Eyeballs on Tuesdays.
And then finals.
And then finals! Holy crap!
Yay.
It's happening! We're gonna get there, and then we'll have all summer to, I don't know, be bored out of our minds in our houses trying to keep the air conditioning running.
I'm trying to take more classes for summer.
I'm trying to find summer classes. I got booted out of my Bio 1 class, so I'm not even teaching Bio 1 anymore. But
What?
I know, the full-time faculty bumped us, so
Damn.
maybe I'll see if I can get unemployment or something for decreased hours. We'll find out.
Seriously.
Everything's crazy. Everything's crazy. We're all in this together. I love you guys. Thank you for being patient with everything. It's been such a gnarly thing. But we're almost there. We're almost there. So,
Thank you.
no problem. Of course, the least I can do. You guys are my only class. It's the least I can do to like try and like do everything I possibly can for you guys. So
Thank you. Thank you. This will be posted later on tonight, right?
oh yeah. Yep, it's going to start converting as soon as we end the meeting, and then it'll take however long it takes to upload to YouTube.
Perfect.
Too long because this was pretty short. This was very short. Yeah, it's a good.
Yeah.
one. All right.
Okay. Time to study.
Later. Time to study. Go study. Bye.
Bye.